oh, CrossFit, that must keep you in business. And I say, you want to know what actually keeps me in business? People who are usually overweight and unhealthy and don't move. That's actually what keeps us all in business as physicians. It's not the CrossFitters that are keeping me in business. And another thing that I usually say with that too is that, you have a rotator cuff problem or a herniated disc. And not that those are insignificant, but those are problems of fitness. And I'd much rather deal with a problem of fitness than a problem of sickness.
This is episode number 132 with Dr. Amy West. Welcome to Pursuing Health. I'm Julie Fouché, family medicine resident and former CrossFit Games athlete. Here, I bring to you information and inspiration from experts and everyday individuals for how to use lifestyle to maximize health. Thank you so much for joining me. Now let's get started with this week's episode. In this episode of Pursuing Health, I sit down with Dr. Amy West, who is a physical medicine and rehabilitation physician, also known as a physiatrist. Dr. West is also a CrossFit Level 1 trainer and an active participant in the CrossFit Health movement. A little bit more background about Dr. West. She's a graduate of Harvard Medical School, and she completed her residency training in physical medicine and rehabilitation at the Harvard-affiliated Spaulding Rehab Hospital. During her time in medical school, she also earned her Master's of Education. We had the opportunity to sit down at the recent Winter Classic here in Cleveland, Ohio, to talk about what exactly she does as a physiatrist, some of the parallels between physiatry and CrossFit, and how she explains CrossFit to some of her more critical colleagues. Now, I know 2 weeks ago I teased a big announcement here in this episode, but hopefully you can hang on a little bit longer. All good things take time, right? Stay tuned for more news very, very soon. Before we get into the episode, this is also a reminder that although I am now officially a doctor, this podcast is meant to share the experiences of individuals and does not provide medical advice. So let's get started with the episode. So welcome to Pursuing Health. I'm very excited to be here with Dr. Amy West. Thank you for joining me.
No problem.
And you are a doctor of physical medicine and rehabilitation and a sports medicine physician.
That is true.
Otherwise known as a physiatrist, which is not a word that you hear a lot. So
that is true.
I'm excited to learn more.
Okay. Yeah.
But I thought that maybe we could start. I also, as I was learning more about you, realized that medicine was sort of a second career, and that's not how you started out in school. So can you talk a little bit about what you did before medicine?
Yeah, so before I ever thought I was going to be in medicine, I worked in television production, and
very different.
Yes, very different. I was involved in editing, like videos. I was an audio engineer.
Okay.
I worked in MTV for a little bit. I was overseas at the BBC in London for a little bit.
Wow.
Working on different television shows and things
so
like
cool.
that. So it was fun.
Any shows on MTV that we would remember?
I don't know if this is before your time, but a show called TRL.
Of
I don't know if you know that.
Yeah.
So
watch that after school every day.
Yep. I did do some work on that. And I worked in another music television show in London that was called Top of the Pops Saturday, which is kind of an institution there. I think it recently went off the air, but it was on the air for like 50 years. I think it was a long time.
So cool.
So
who would have guessed?
Worked with lots of celebrities who were cranky and stuff. So got out of that.
Yeah. So that's obviously a big sort of 180 switch. Yep. What were some of the driving factors that made you think, wow, maybe I want to go into medicine instead?
Yeah, well, it was, one, the working television industry, it's kind of episodic, so you're kind of always bouncing from thing to thing to thing, which was like, not really my thing. Mm-hmm. But also, I just felt I really wasn't doing anything for the greater good of the world,
Okay.
So, I was worried about, what colors that should be in Jennifer Lopez's dressing room rather than like what is actually important in life. Mm-hmm. I also, I've always liked school and doing nerdy things, and I figured if you have the ability to do those things and understand them, then you should probably be like harnessing that for some good reason, for some good cause, So I sort of started looking into medical things and sort of reading about it and saying, I think I'd like to do that. So then I went back to school and did all the courses you need for that and sort of went back to school that way.
Okay. And then in medical school, obviously I don't know, in my experience,
Mhm.
we did not get a lot of education about movement in medical school. I think I remember maybe one half day where we learned about cardiac rehab, and that's about it.
Yep.
So I'm curious as to how you, I mean, it's hard. I think it's hard to find out about PM&R even as a med student and what's involved. And so how did you, like, did you know you want to do that from the beginning, or how did you end up down that path?
So I definitely did not know anything about it before I discovered it. And actually, so, you know, I went to med school at Harvard, and they have a very large rehab institution associated with the med school. But it's kind of a big secret. So I sort of actively tried to find out about it.
Which is crazy, right? Because it's like movement is so important for our health.
Exactly.
So why do we keep it a secret?
Yeah, I mean, like, you know, so I was always big into sports, and I started thinking, like, how can I do sports medicine, but I don't necessarily want to operate. I want to be a surgeon. So how do I do that? And actually, there was a lifestyle medicine interest group at our med school. And the person who was in charge of that, I kind of said, oh, I like kind of what you're talking about. I'm interested in doing sports medicine. I don't think I want to necessarily do surgery. And she said, oh, I'll introduce you to the people over at Spaulding who are doing that. So I didn't find out about them really through school or through our curriculum. It was sort of an extracurricular thing that I kind of stumbled upon. And then I did some rotations out over at Spaulding, and just coincidentally, I was rotating there right at the time of the Boston Marathon bombings, and we had started getting all of those patients who had lost limbs in the bombing, and it was just such a incredible experience to be working with those people and seeing the role of physiatry in that setting, you know, post-acute care, but really getting people functional again. So that's why I just gravitated towards it at that point, and I was set, but I was pretty late into I did an education degree while I was in med school, and so while I was doing that is when I sort of had extra time to kind of.
So did you take extra time in med school, like an extra year, or how did that fit in?
So it was right after after my third year. So I was like, so I did an ed degree, and people are like, well, why'd you do that? But as physicians, we're educators anyway, like whether you want to be or not.
Physician means teacher, or like right? It comes from the Latin and Greek. I don't know. It comes from the word for teacher. I know that.
I mean, you're constantly educating people anyway, but also with my video background, I was able to kind of experiment with some things in that way.
That's really cool.
And then also, you know, you're teaching the people underneath you, like the other medical professionals. And most people in positions who are in charge of medical education have no formal education background. So it was, you know, just a way to kind of look further into that.
That's amazing. You said you were into sports. Did you play sports growing up, or what were you interested in?
I played anything and everything as a kid. I guess like basketball and softball were my main sports, but I grew up with an older brother who, you know, used me as a target for anything. So I, you know, got into sports that way. And I just, you know, and then I played, I played sort of semi-professional softball in Europe for a little bit, and you know, it was fun. But it's the kind of thing is you finish that, you play team sports your whole life, and then you're kind of like, all right, well, now what? And like the world is sort of saying, okay, well, get on the treadmill. That's what adult exercise is now. And I was like, I hate this.
I felt the exact same way. It's like, you know, you should be doing something different, but you can't really figure it out until I found CrossFit.
Right.
How did you find CrossFit?
So where Harvard's med school is, it's very close to like the Fenway area in Boston, and the original CrossFit Fenway, which is now called something else, but CrossFit Fenway was I'd have to pass by it to get to school, and I used to see them doing stuff, and I want to do that. And then I remember seeing the games on TV, whatever year that was, 2012, you probably in it at that time.
That was when 2012 was one of the last years I was in it.
Yeah, so I think I saw you guys doing stuff, and I was like, I feel like I could do that. But I want to find out more. So I kind of I started, you know, I was doing like 3 classes a week, and then it was 4 classes a week, and then I just gave up the other gym membership I was doing, and it was full time, and I haven't looked back.
That's awesome. So what year in med school were you when you started?
I think it was that year that I was doing my School of Ed stuff, or just at the end of my third year. Yeah.
It's a good time to get into it.
Yeah.
At that point, were there other classmates who were doing CrossFit, or is it something that ever came up in conversation as you were going through like your rotations or classes?
No, it was at the time, because CrossFit in general at that time was kind of a newer thing, certainly on the East Coast. So no, I didn't know any people were doing it. I think some dental students were doing it because they had more time than we did. So they were, I think a couple of them were into it at that point, but yeah.
So you were kind of on your own then. I felt like a lot of times in med school it was like this secret life. Like
Yeah.
you go and study and then you're like, okay, I'm going to go to the gym and be with other people. It's nice also to be with other people who are not just in your same situation studying medicine or doing the same thing, and be able to interact with people from all different walks of life. I think it's very refreshing when you're in such an intense program.
Yeah, it's like you need to see other people and be involved in other things and like get your, just be able to separate yourself from that situation for a little bit. So that was I think right around that time, Glassman had appeared at the Harvard School of Divinity and sort of saying that, CrossFit in a way is kind of like a church in that sense, that, you find a community of people, you're interested in things going on in their lives, you go to their weddings, you're sort of always involved in other people's business, but it's like a nice way to experience other people outside of work and school and all that. So it was cool.
That's really cool. So it sounds like this sort of happened around the same time. You're starting CrossFit. You're deciding that you're going to do PM&R. First, can you explain what PM&R is?
PM&R. So PM&R is, so it stands for Physical Medicine and Rehabilitation. So it's PM and R, not PMR. It's a disease. It's something different. PM&R, Physical Medicine Rehabilitation, also known as physiatry, also known as physiatry, depending on what part of the country you're in. So that's part of the thing that's confusing, is that we have multiple names. But what we are, we're doctors of function, essentially. So we treat physical manifestations of disease processes. So we don't necessarily treat the primary disease. So whether that's, I usually use the example of cancer. So like I don't prescribe chemotherapy. I'm not treating the cancer process. Leave that to the oncologist. But the things that I would treat are sort of how the cancer and the chemo affect your body. So whether it's neuropathy, are you getting to and from the bathroom? Are you walking? Things like that. Pain, stuff like that. We treat injuries of all kinds. So things that are temporary, like sports injuries. That's kind of what I do full time. But we also treat injuries that are more permanent. So traumatic brain injuries, spinal cord injuries, sequelae of stroke, cerebral palsy, things like that. So we treat how those processes affect the physical and cognitive function of people.
And then how does physiatry work with like physical therapists and occupational therapists? Like what is the relationship like, or from a patient's perspective, like what are the different roles of their team? Yeah,
so that's that's another thing I like about physiatry, is that we're very much team players. We sort of, as physiatrists, we're kind of only as good as the staff around us as far as like therapists are concerned. So so we all work together. We sort of manage the medical end of things, and we sort of prescribe therapy. So the physical therapists are there with the patients doing the therapy. We prescribe it. We sort of do some long-term rehabilitation and discharge planning. We treat all the medical things. Certainly on an inpatient side, we're kind of handling the medical issues, but outpatient, we're sort of treating those things kind of more from the medical standpoint, whereas the therapists are kind of doing the hands-on, like day-to-day stuff. So we work together, though. We're kind of always bouncing ideas off of each other and working together.
It seems like a good group to work with. And
it's a pretty cool. It's a pretty cool scene. Yeah,
I know. I love all of the physical therapists that I know, and it's something where I think, like, if you're not in physiatry, like most other physicians have no idea about movement. So like, we may prescribe physical therapy, but most people have no concept of like what's happening when you send someone or, refer someone to a physical therapist. And so it has to be cool to be able to like, be more hands-on and see what's actually happening with the patient. Yeah.
It's, most physical therapy prescriptions that are coming from non-physiatrists say eval and treat, whereas ours tend to be, if anything, a little bit overly verbose. We kind of get into the nitty-gritty of it, but also, but this is something that even in the physiatry world, I in some of the talks I give, I talk about what does good movement mean, and what are the principles of good movement. And sometimes people have a hard time articulating that, physiatrists, physical therapists included, because we focus a lot on, is this person strong? Are they, do they pass these sort of strength tests? But we don't look at that necessarily from a more kind of central nervous system standpoint of like, how is this person moving? What is the kind of coordination and neuromuscular involvement in certain tasks? So that's, even in physiatry, that's a bit of a novel concept, surprisingly.
Right.
Yeah.
So when you are assessing a patient, what are some of the things that you're looking at from a physical or movement perspective?
So, something I commonly see, for example, would be like people come in with back pain. It's sort of something we see quite a bit. And, firstly is, you're looking at someone's like body habitus and sort of like that that's, a lot of times the elephant in the room,
Right.
It's like, okay, so yeah, you're in pain, you're having pain with certain things, but, for every, 10 pounds you lose, the amount of pressure that goes through your joints is reduced by, I forgot the number, but, significantly.
Yeah.
So that's part of it is, looking at what's this person doing kind of outside of moving, like what are they eating, all that stuff, which unfortunately we don't have a ton of time as physicians to talk about,
Right.
but, it's like something like another box to check. And then, you're sort of looking at a lot, oftentimes when people are coming in with like a radiculopathy, so like herniated discs in your back, it's not, people will say, well, what, I was like lifting my kid up and I felt pain, or I was putting something in the dishwasher and like now I'm having all this pain.
Right.
And the way that I kind of see it is that, these things are happening. There's not just an instant where it happens. It's chronic, faulty movement patterns that lead to degeneration and then subsequently, a herniation or something like that. But, so I'm looking at, like, how is this person experiencing their symptoms and what kind of things are they doing on a day-to-day basis as far as like lifting techniques or like, a lot of times people like bending over and like cleaning the floor or something like that. I just had someone with that. And I'm looking at to see, how are they moving? Have they ever been taught to move? And, what kind of things in their day-to-day life, like what sort of functionally, what do they have to do during a day to kind of either make a living or take care of their family and stuff like that. So, and then how can we adjust that? So that's usually.
It seems like physiatry takes a much better look at root causes of problems and trying to address those. Whereas like I think of from sort of a family medicine perspective, the standard of care would be like someone comes in with back pain, maybe treat them with NSAIDs and muscle relaxers, and like maybe if you're really on top of it, you refer them to physical therapy after they're feeling better to like work through some of those movement patterns. But more often than not, they're not actually even getting to the physical therapy part.
Right.
And then they're going to come in with the same problem again later on if the root cause isn't fixed. But it seems like you, at least from your training, you have a much better lens for being able to assess that and treat it.
Yeah, I mean, so like functional status is like, it's kind of one of our vital signs as physiatrists. We're always looking at, what is your home setup? What are you doing day to day, in order to function in society, and how do we optimize that? So, putting a patch on something like, giving someone, muscle relaxants is going to help for like a little bit, but like, it's definitely going to creep back into their life. So, we do a little bit of that too, but but we kind of consider that other stuff as well.
Right. And I know you also talk a lot, like you said, you're really looking at really functionality, like how are people moving and how are they going to be able to do the things that they need to do in life. Yeah. So I'm curious, it sounds like you started CrossFit really just for your own health and to work out and have fun. And then at what point did you start to realize, hey, maybe what I'm doing in the CrossFit gym and what I'm doing in medicine have a lot in common?
It was pretty quickly, actually. Within a couple of months of me doing both, it's almost frustrating in the sense because I was involved in these two activities that were so similar and had so many of the same common goals of function. So, and it's really been a journey over the past, 7 years of trying to make the two communities aware of each other. Yeah. So, it's been interesting because a lot of the principles that I was learning about in lectures are things that were sort of reinforced in the gym. And I'd say, well, these two things should be on the same page. Right.
We're doing the same thing. We're just going in parallel directions.
Yeah. So I'm still working on that. I'm still working on getting the two sides to see each other. But
what are some of the ways that you have tried to do that, or how do you handle that situation? Like say you're sitting in a lecture and you're seeing the similarity. Like how do you try to introduce that to your colleagues?
Well, it takes a lot of creative phrasing. I think, unfortunately, the word CrossFit in the medical community can often turn people off right away. And usually those are people who have very little understanding of what it is. So it's a lot of times it's about establishing the goals. So if someone's talking about, functional status and how can we improve that in our patients, you say, well, I know a way. And sort of introducing it, like, kind of getting them to agree with the principles of CrossFit. And then it's sort of like you sneak in the back door. Oh, by the way,
like this is being done in CrossFit affiliates all around the world.
Yeah. So, I gave a talk at one of our conferences not that long ago, and about that exact thing, improving functional movement through functional fitness and improving pain through functional fitness. And, so at the end, people were asking me, where can we go to get this kind of training? And I was like, well, funny you should ask. And that's so it's been a lot of like creative, like sneaking it in the back door kind of thing.
Did you notice that people were receptive to it when you did that? If you then like used the word CrossFit at the end when they asked that question, were they maybe more open to?
Yes, they're more open to it that way. But even certainly like up front, like saying the word is like, not good. But sneaking in the back door, people are a little more receptive or a little more likely to say, oh, wait a second. In CrossFit, I thought they did this. It's like, oh, actually they do that. You know, so it's more well received that way. Yeah. But there's still like a stigma that's attached to it.
For sure. It's so interesting, like how strong the stigma is and how much of it is just misunderstanding. Like I think anyone who sits through the CrossFit level 1 basic lectures, like what is CrossFit, what is fitness, like no one's really going to disagree with any of the stuff they're talking about, right? It's really basic principles that make sense. But a lot of the misunderstanding just comes from these experiences or like preconceived notions about what CrossFit is and what it isn't. And, you know, of course, there's a lot of different expressions of CrossFit out in the world, and depending on how you're exposed to it first, you may, you know, jump to certain conclusions. Right. I think it's like that about a lot of things in life. Like people love to label things and, you know, label them as good or bad and not really learn the true meaning behind them. So
yeah, I mean, you know, people say, well, I went to a CrossFit gym and I didn't like it. And it's like, yeah, there, you know, maybe there are some coaches that aren't great. There are some physicians that aren't that great. There's some therapists that aren't that great.
But there's hairdressers that are not great. There's like
you don't like write off the whole thing, you know, as because of that. So yeah, I've been, you know, working on combating those things, but then also, you know, a lot of in medicine they want, where's the evidence? You know, where's the scientific evidence? And that's an evolving thing as well. So, but there's a lot of evidence supporting the principles of CrossFit. So you say, well, if they support high intensity functional movement, then you kind of are supporting CrossFit. You know, it's like we're all kind of on the same page here. So
right, it's just when you wrap it up and call it something, it seems like it's different.
Right.
What do you? Well, it's kind of similar. I think about like in functional medicine, where I think people have a lot of strong opinions when they hear that word because they think of, you know, what it may or may not be in different ways they've seen it practiced. But when you like back up and look at the principles, it's like, well, what is functional medicine? It's trying to get to the root cause of disease. Like most people are going to say that's probably a good idea.
Yeah, probably,
you know?
Yeah, that makes sense.
But then there's a lot of different ways to implement it that people may or may not agree with.
Right.
What do you say? I mean, I get this reaction all the time when CrossFit comes up in conversation and I'm around other physicians. Then when they're immediately saying like, oh, that's, you know, this guy was in with an injury the other day from CrossFit, or that's where I get all my business from as a orthopedic surgeon. Like, what do you say when doctors respond like that?
So I am employed by an orthopedic surgery, you know, department. So I've heard that before. Oh, they say, oh, CrossFit, that must keep you in business. And I say, you want to know what actually keeps me in business? People who are usually overweight and unhealthy and don't move. That's actually what keeps us all in business as physicians. It's not the CrossFitters that are keeping me in business. And another thing that I usually say with that too is that, you know, yeah, okay, you have a rotator cuff problem or a herniated disc. And not that those are insignificant, but those are problems of fitness. And I'd much rather deal with a problem of fitness than a problem of sickness. So I'd much rather treat your rotator cuff than worry about your diabetes and your end-stage renal disease and your hypertension, because that's much harder and much more grave situation than, doing some rehab for your shoulder. So those are usually the two things I say to that.
It's a great perspective. And when you think about other things that people do for exercise, like no one's saying like, oh, you're running, like that's keeping all the orthopedic doctors in business. Like you should stop running. No one says that, but running has tons of injuries.
And the injury rate in running is far greater in any research study. It's like 3 times as high as CrossFit's been recorded. So, and what's also really, from a rehab perspective, which is really kind of frustrating, is that a lot of the principles of CrossFit are being used as rehabilitation protocols, actually. So the same thing you're telling me causes injury is those principles are being used to prevent injury. Interesting. So
something's not adding up.
So that's another kind of one of those things where you're like, I don't know if this makes sense, but
again, I usually kind of take a step back and think about, this is probably someone who doesn't really understand what CrossFit is, and this is like their first knee-jerk reaction to what they're going to say. And most of the time, if you can like educate them, they'll come around to it.
Yeah, and showing the evidence and sort of, what evidence is there. And then, there's this whole thing about, the evidence, the quality of it, and who's sponsoring it and all that. So it's a little hard to talk about it without seeming like a conspiracy theorist, but
right.
But it's fact,
It's true.
Yeah.
Right? It's unfortunately the world we live in.
Yeah.
Okay. So I've talked about this on other podcasts, but we have sort of this, we have a medical system that takes care of people when they're like acutely injured or acutely ill, kind of rehabs them back to as we talked about in our sick, well, fit continuum. And then, on the other hand, we have CrossFit, which is doing a great job of helping people get fit.
Right.
But it seems like there's lots of opportunities to make this sort of one continuum, like where you could go from an acute setting to an outpatient rehab setting, then to a CrossFit affiliate where you can be in sort of a baseline maintenance stage of maintaining your health and your fitness. Yeah. Have you seen that happening anywhere, or do you see opportunities for us to like take advantage and create a better, a better bridge?
Yeah. So, that's another thing that, coming from a rehab perspective, where I see so much opportunity for it and say, wouldn't this be great if we just got these things in place? But I think particularly in the adaptive sports population, so people with like, wheelchair athletes or people who are post-acute rehab from whatever, a traumatic brain injury, or even, kids with cerebral palsy, things like that. A lot of times, their PT days run out. We discharge them home, and they've done all the PT that they're going to do, and then, they're looking for something else. And it's like, well, I've seen, there are multiple adaptive sport, CrossFit organizations that are kind of popping up all over the place, but I've seen those programs work out really well, and not just providing the functional training, but also providing a community, and
it's huge.
Getting and also preventing chronic disease in those populations, because it happens probably even higher rate than it does in sort of so-called able-bodied people. So being able to kind of bridge that gap is pretty cool when you see it in motion. But as far as like it's connecting. I think big hospital systems in general are like a little weary of connecting themselves to like a CrossFit. But if you, it's the kind of thing, if you say, I'm doing a exercise class for people with spinal cord injury, everyone's like, yay. And then you say, I'm doing a CrossFit class for people with spinal cord injury, everyone's like, that's dangerous, don't do it. And you're like, it's the same. We're talking about the same thing, people. Like,
it's like semantics.
Yeah. So again, it's like one of those, like, let's talk about CrossFit without talking about it kind of thing.
Right. What is your practice like now, and how do you incorporate CrossFit or CrossFit principles with your patients?
Yeah, so I'm like I'm a non-operative sports medicine physician, so I'm essentially like an orthopedic surgeon without the surgery part. So I see a lot of sports injuries. And and injuries, people, like I said, people who are picking something up out of the dishwasher and get hurt. So that's a great opportunity with that. To kind of talk about movement a little bit and kind of say, well, maybe the way you're moving is what caused this. And then I also, as far as like the sports injuries go, I've actually, like where I'm working, I've worked to kind of get into the gyms and kind of, talk with the athletes there to kind of create that bridge, sort of if they have any kind of, injury or whatever, I can treat that. But it's interesting. So when I first started this job, not that long ago, we didn't have our like white coats in yet. So and it was like summertime, so I was wearing a lot of like sleeveless shirts.
Yeah.
and from that, at least 2-3 people a day, patients be like, "What do you do?"
Yeah.
Because I want to do that. And then that presented a great opportunity for me. Like,
That's awesome.
by the way,
free advertising.
Yeah, seriously. But it's like, and I don't know if this has happened to you, but as a woman, having people respect your opinion, certainly in an orthopedic setting,
yes, for sure.
My arms get me more respect than my white coat does usually. So it's kind of an interesting. People just kind of assume that you know what you're talking about. So,
right.
It's been an interesting kind of learning experience in that sense.
Well, how powerful it is to practice what you preach. Like if you don't look fit, or you're overweight, and you're trying to tell people to eat better and exercise, like how much are they going to trust you?
Right. Yeah. And I've found some boxes that are kind of near where I work, and a lot of like healthcare professionals from the hospital go to that box, and it's like we're working on creating something like let's get a physician day, or like a healthcare worker day, or let's kind of try to set up a class for older people at the gym nearby. Like there's a lot of opportunity that's available, and it's just a matter of finding people who are interested and getting like the organization behind it. But yeah, so I'm always trying to find new ways to kind of weave it in and bring it up. So.
For sure. How about in working? I know you're doing work with residents and education too. Yeah. So is that something that you talk about with residents, or how do you introduce it in that setting?
Yeah. So, when I was a resident, I would talk about it a lot with my attendings, because and when I first started residency, they had all these ideas that were false, right? So I sort of started talking about it, and actually one of my mentors in med school, Dana Kotler, who was big into cycling and stuff, and I over time convinced her to start going. So she started going, and she got her mom involved, who's in her 70s. I think she just turned 70. And now this woman is like a beast. She is like, and she, she'll talk to me about like, oh, I'm doing CrossFit, and it's helping me like doing my laundry. It's helping me pick up my grandkids. And I'm like,
amazing.
You're like a commercial for this. You don't even know.
Can't make this stuff up.
You can't make this stuff up. So, and like I was just at her birthday party recently, and all her friends were like, this woman's incredible. And, and it's like stuff like that. So you kind of help people. I kind of like slowly turn the tide where I did my residency. So now I'm in a new location with new people. So I'm trying to I'm starting from square one again, trying to get people like, first let's talk about what it's not, and then we'll start getting you moving, and then we'll kind of, get you on board. So it's a fresh start, and I'm still working on it. But I would say that the residents I've worked with are interested in finding out more. And like I said, you walk around without some sleeves on and people have questions. So you go, okay, well, let's talk about it then.
Let's talk. Right. It's so true. Yeah. It's interesting though. I wonder so I've sometimes seen the opposite too, where I wonder if just like the way that I appear, maybe with muscles, is intimidating for patients who feel like maybe I can't relate to them. So if I have a patient who's like very overweight, who's not exercising, it's, you get that kind of like, well, that's easy for you to say, like you're in good shape, kind of, you don't understand what I'm going through, which is true.
Right.
But that's something else to kind of be mindful of, is like, how do you show people that it's something that anyone can do? Like you don't have to look like me to do CrossFit. Yeah.
That's certainly a barrier in to talking to people about it. Luckily, so I'm in a orthopedic sports environment, so people are a little bit more trying to like be active and try to, or have gotten injured doing something active. So it's not as hard as it would be like in a primary care clinic. But yeah, so people will say to me like, I can't do that, or that's for, like athletic people or whatever. Right. And I'm like, did you get up off a toilet today because you squatted? Like, did you put your pants on today because you just did a deadlift, and sort of like trying to make people see that they're doing these things anyway. I have people that I work with in my office who, they go, oh, Dr. West, what do you do for your arms or something like that? Or what do you do? And I go, I haven't used an arm machine in like 10, 15 years, but like it's just a matter of like, I'm doing things, that you probably do every day, and it's add some weight to it, and you don't have to start off like, we can do the same workout, we can work out together. We might not necessarily be doing the same exact thing, but we'll be doing similar things. And so I try to tell them, like, you know, try to make them see that like a lot of the stuff that we're doing is like not that crazy. But you know, it's always a work in progress.
Right. And it's nice now that, you know, with I think the shift that CrossFit is making and putting more out there that is showing people doing this in the home setting or doing this when they're, you know, older or overweight or whatever it might be. I think there's more for us to use as tools to show patients.
Yeah, the CrossFit website with the home exercises and the guy with like the antifreeze jugs. Yeah, but that stuff actually like speaks to people, and it speaks to physicians also. Because other physicians, like, I'm not going to tell someone to go to a CrossFit website, and I'm like, okay, but look at these exercises. I'm like, oh yeah, actually that's what I would recommend. You know, so that's helpful too. Yeah,
I've had doctors like go to the website and be like, wow, I had no idea this is what CrossFit was all about, and it's like, it's been a good change. I mean, it's obviously. There's two different, you know, pendulum swings one way, swings the other way. There has to be sort of a happy medium, but I think it's been really useful for a lot of those situations. And I mean, there's enough out there now. You can find videos of people who are 90 or 100 doing CrossFit. And those are some of my favorite ones to show people because it's hard to say like, oh, I have to get in shape first before I do it. And it's like, well, look, if he can do it, you can do it.
There's a 90-something-year-old lady who goes to one of the gyms that I go to, and anytime someone says, I can't do that, I'm like, look at this, and I show them her Instagram. And they can't say anything after that. So,
it's hard to say anything. That's good. So one of the things, I know we're both sort of involved in CrossFit Health, and we've been following that movement for the past couple of years, and you know, there's doctors of all different specialties in the movement, and I think there's different ways that each of us can incorporate CrossFit and the principles into our practice. But I think one of the interesting angles, especially being in the world of sports medicine, is how I mean, we talked about controversy in terms of just, you know, introducing it to your colleagues, but there's like on a big level, I mean, there's a huge lawsuit between CrossFit and the NSCA, which just had sort of like a big verdict this past week.
It did.
But you are very involved in both worlds.
I am.
So how do you navigate that? And what is your approach being someone who's, you know, really practicing in both worlds?
Yeah, it is difficult. I mean, for example, when I was interviewing for fellowships, you know, I was involved in CrossFit at the time, and people saw that like on my resume or whatever. And so one of the people that I was interviewing with said this to me, and someone who, I'll say that this person is someone like I highly respect and revere as a clinician. But he said to me, he goes, well, you know that Glassman guy's nuts, right? Like all the people involved in that are crazy. And I just said, okay. You know,
like, so, well, you're like, I'm trying to get a job.
So, you know, like sometimes you're in a position where you're like totally powerless. So you just have to kind of say, oh, well, okay, you know.
Interesting that you think that,
Or like they'd say to me that, oh, it must keep you in business kind of thing. So part of it is like having an answer prepared for when those situations come up. And, you know, so like last year I spoke at the ACSM's conference about a totally different subject. But you know, and that conference is like exercises medicine everywhere. The NSCA has a booth there, and I have my Keep Fitness Legal shirt on. And I was gonna like walk by the NSCA booth. I don't know if they would have necessarily known what it was, but but you know, so I find myself feeling like really weird about it. And you know, like the Exercise Medicine campaign, you know, they're primarily funded by Coca-Cola, and you know. And I say to myself, like, do I want Coca-Cola making recommendations about exercise? And would I recommend those things? And to me, it doesn't feel right, right? But I do know a lot of people who are involved in the Exercise Medicine campaign, like some really brilliant physicians and researchers and you know, people who are not like taking any checks from Coca-Cola. You know, these are people who are just trying to do good work. And, you know, and do good work too. But, you know, but it's just sort of the backstory that's feels weird to me.
And that a lot of people probably don't know about, or how involved it is, or how, you know, exercise in medicine sounds like a great concept.
Yeah, I love the idea. That's great. Let's do it, you know. Same thing with one of the biggest sponsors of the ACSM conference too is Gatorade. They have the whole Gatorade Sports Science Institute, and they have like a huge booth there, and they're telling people about, you know, how much Gatorade to drink and stuff. And it feels weird to me to have to kind of be in the middle of that. So, you know, part of it's having the knowledge to to know the backstory. And like I said, even, you know, I've explained this to people who are involved in it, you know, and they were like, oh, really? I didn't realize that Coca-Cola had a hand in this, you know, or, you know, they don't know necessarily the backstory. So they're just out there thinking they're doing, you know, good stuff, which they are, but like they don't realize like kind of who's kind of guiding it from below the surface there. So it's a little bit of a weird space to exist in. I'll say that because, you know, you say the wrong thing, you piss off the wrong person.
Right.
But,
you can't please everybody. That's for sure.
You know, so like, yeah, I'm involved in the academic side of sports medicine for sure. It's just certain things that feel a little weird to me.
For sure. And I think a lot of people that's one of the things that Greg has been so passionate about is a lot of people didn't know the funding behind a lot of these things. And he, you know, through his own experience of getting drug into this case with some fraudulent data in a research study, his mind has been blown by how corrupt a lot of research is in medicine and a lot of these organizations. And so that's been really one of his drivers, is to just expose this and educate people on who's behind some of these organizations and guidelines, and try to separate the two so that we're not having conflicts of interest that are not dictating, but that are influencing the medical care that we're giving.
The last DDC I went to, there was, I forgot who it was who was speaking, but the amount of money that's being funneled to all of the major medical societies for like every different specialty through the sugar industry is crazy. And just making, and most of the people involved in those organizations do not know that. So, you know, it's like you could still take the advice if you want to, but just know where it's coming from is kind of the, you know.
Right. Yeah, it's pretty eye-opening. So this past week, they basically, I guess the judge made a ruling that, you know, they're trying to end this case, and they sanctioned the NSE, I think, with like $4 million or something like that. What do you think the impact of that, what do you think is going to be the impact of that on the NSCA, sports medicine? Like, do you think that will in any way help people look a little bit closer at what's going on, or
I don't know,
think differently about CrossFit? I mean, that's a pretty big deal.
Yeah, it is kind of a big deal. But, you know, that ruling, I mean, as far as the legal fees and the money is concerned, that's newer. But like that finding of fraudulent data being out there has been that ruling was made a while ago. Right. And
have you seen that make any impact in the community?
Not really. I mean, as far as like people don't know about it. You know, if you're in our community, you know about it. But if you're in their community, they just kind of put it under the rug, kind of. So.
And I think people don't, you know, they hear about things like that, or you hear about one study, you're like, oh, it's one study. We don't realize like how it's so widespread in research for there to be, you know, there's conflicts of interest, there's fraudulent data, there's like data manipulation happening all the time, even if it's subtle, that's influencing the data that we use to practice medicine. And it's kind of scary as a physician, because you almost don't know what or who to trust at times.
Oh yeah, it's hard. I mean, and that, you know, and if you start talking about this stuff with people in the medical, you know, world, they see you as a little bit of like a conspiracy theorist. And certainly there's lots of good data out there, and like people doing good things with with just like a pure heart. So it's not like a you know, we're not condemning all research or anything like that, but it's hard to know, you know, especially when it comes to like nutrition stuff, and you could find studies that support any way you want to eat. Oh yeah. You know, so it's really but what I found interesting over the past few years is that sort of even like ACSM guidelines or exercise guidelines are sort of starting to mirror CrossFit principles. They're kind of like 5-6 years late to the party, but they're slowly like starting to mirror them a little bit, which is interesting, because we've been doing that, but now you're recommending it. So that's, you know, like now, you know, like high intensity interval training was kind of like the hot topic for a while, and it's like that's part of what we do. It has been for a while, but people are now sort of seeing like, oh wow, this is effective and time efficient and it works. Like, oh yeah, okay.
And functional movement, like who can argue with that?
Right, you know? Exactly. So you know, even that whole thing is like sort of coming on the scene now, and it's like, yeah, well, yep.
It's very interesting.
Yeah.
All right. Well, I want to start wrapping up. There's 3 questions that I usually ask at the end of every podcast. Okay. So one is, what are the 3 things that you do on a regular basis that have the biggest positive impact on your health?
Oh, okay. Well, one, I guess, is the obvious, so like CrossFitting,
Mm-hmm.
right? But it has effect.
And what does your CrossFit look like now? Are you doing classes? Do you go to a certain number? Do you work out a certain number of times a week, or how do you fit it in with work and everything
Yeah,
else?
so I mean, I make it a priority to go.
Mm-hmm.
So whether I'm going early in the morning before work or after work, it's like it's one of the things that I kind of have to do on a regular basis, unless extenuating circumstances. So I try to go between like 5 to 7 times a week, but I try to do that. Also, it's and not just for like my physical health, but for like my mental health and my like social interactions, and just to kind of be involved in a community of people. So for me, that's very important as far as like just sort of getting a handle on that. So that's obviously the first thing. The second thing, I recently, well, maybe within the past year, I started paying more attention to my nutrition and just sort of being mindful of what I'm putting in my body. I was always mindful of it, but like really kind of getting a better sense of like macros and really looking into that whole thing. So now I've started to, I'm more aware of what I'm putting in my body. So, I guess that'd be sort of the second thing is making sure I'm eating well and
And what does that mean to you in terms of, you said maybe measuring a little bit, but in terms of food quality or food choices, what does that mean, eating well?
Yeah, so I've been trying to, I'm doing a lot more measuring of things, making sure that I'm getting enough, protein. I'm not like just mindlessly eating, like, oh, in the office, they have, they'll have someone put something out and then like before you know it, half the thing is gone, like, what did I do? So, just stuff like that, just, making healthy choices, but not being so restrictive that it kind of impacts everything, but just making, being just more smart about it. So.
Love it.
Yeah.
Okay, so that's 2.
Oh, 2. The third one is, recently, because I recently moved and, finished training and I'm starting this job. And recently I've just been like, not saying no to things, like someone invites you somewhere, go. Something interesting is happening. Like, let's go check it out. Like, I'm just trying to stay as involved kind of with all things, or like even coming here to do this. It's like, yeah, sure, let's do it. Because you don't know who you're going to meet. You don't know what kind of situation you're going to be in that can be, just, meeting new people, doing new things, trying stuff out and seeing what happens, so I've been doing that more recently, which I can be like a pretty like shy person and just kind of be in the background, but I was like, you know what, something's happening, let's do it. I'm in,
just be open to what can happen.
Yeah, exactly.
Awesome. So, and by here, you mean, so are you living, it's in New York now?
I'm in New York, yeah.
Okay. And we're in Cleveland, which I'm so excited that all these people came to Cleveland where I live.
Never been here before, yeah.
But we're here at the Winter Classic, which this is the 3rd year that they've hosted this event here. And it's been really cool to see it grow and really more of a focus on this like health and longevity aspect of CrossFit and an opportunity for anyone to come compete and sort of get sort of a mini CrossFit Games or like what a regionals might have felt like, but it's in a very low-key setting, fun kind of team environment. And so it's grown every year. Like this year you gave a talk that had a lot of different sort of health and wellness and medical focused talks, and I'm hoping that it will grow every year.
Yeah, it sounds like Jason, who runs this event, has some big plans, so it should be every year getting bigger and better, so it should be fun.
I think so. All right. What about one thing that you think would have a big impact on your health, but you have a hard time implementing it or you haven't started it yet?
Sleeping well.
Yeah.
I always like say I'm going to get to bed earlier and earlier, and I just don't because I have 100 other things to do.
Because you keep saying yes to everything.
Exactly. But it's very true though. Like, I'm like, oh yeah, I'm just going to go do this and do that. And the next thing I know, it's, it's midnight. And I said, what am I doing? So, So I definitely sleep quality and, like shutting like screen time and like shutting that stuff off. I'm like everyone else kind of addicted to the screens and
it's an epidemic like everything else.
Yes, exactly. So trying to get that under control a little bit. Yeah,
for sure. What does a healthy life look like to you?
Healthy life look like to me? Moving well, eating well, and feeling sort of fulfilled mentally, being happy with, the everyday, which, can be hard, but, just getting up every day looking forward to what's going to happen. Like, that's like true health, you know? And then all the other stuff kind of falls into place after that.
So true. I love it. Awesome. Yeah. Well, this has been great. Thank you so much.
Thanks for having me. Yeah.
Yes, and hopefully people picked up a few tips about how they can talk to their doctors or their colleagues about CrossFit. And I think people like you will keep paving the way in sports medicine. And I think...
Gonna try.
Yeah, we're only going to keep seeing these principles. Like you said, like the principles that Greg has been preaching for years are so fundamental that like they're all going to come to the surface, whether you call them CrossFit or you don't. But it's cool. You know, I think the most exciting thing is just how widespread it is and how we do have these 15,000 affiliates around the world. Mm-hmm. Like there's nothing else with that much power to actually really change people's lives and lifestyle.
Yeah. I mean,
of
like
that magnitude.
As, you know, as physicians, we can make recommendations for, you know, you should eat better. You should, you know, you should do more exercise. But it's like really those things aren't effective until they become habits.
Right.
And the habits are formed in the box. That's where people are really making these things lifestyle choices more than just like, I'm going to try eating healthy for a week and then they stop, you know? So it's important in sort of continuing our recommendations forward. So.
Awesome.
Yeah.
Well, thank you, Amy.
Thanks a lot.
Hey there, thanks so much for tuning into this episode. It was really great for me to chat with Dr. West about what she does every day, as she has a really wonderful vantage point between what's happening in physical medicine and what's happening around the world in CrossFit affiliates every day. Here are some of my biggest takeaways from our conversation. Number one was to focus on the root cause. So I loved the focus of Dr. West's specialty, PM&R, was on addressing root causes and restoring functional movement. And I think this is such an important perspective to have, and one that many medical specialties and treatments lack. So whether it's an ache and pain or a pain that you're feeling in the gym or another symptom, the ultimate goal eventually should always be to try to figure out what is the root cause and how can we address that in order to prevent future complications down the road. I also loved Dr. West's distinction between diseases of fitness and diseases of sickness. So while the data we have now shows that injuries in CrossFit are really no different than injuries in any other similar physical activity, it still is a common point of contention for many people, especially those who don't really understand CrossFit methodology. But if we're talking about overall risk and benefit, I know I would feel much more confident about my overall health by living an active lifestyle, even if there is some risk of injury, or as Dr. West says, a disease of fitness from time to time. And I'd rather take on that risk than live a sedentary lifestyle, which itself has increased risk of metabolic disease, cardiovascular disease, and even joint pains from arthritis that often result from being overweight or lack of using those joints. So it takes us back to CrossFit's sickness, wellness, fitness continuum, and that concept that we know that no matter what, life is going to throw us challenges. So whether that's an injury, whether it's getting in a car accident, whether it's having another stressful life event, but if we're already living in fitness, we have that buffer against sickness and we can be much better equipped to bounce back quickly. My third takeaway from this conversation is to always be curious about where the money comes from. So Dr. West talked about informing others in her field at professional society meetings where money was coming from to support some of the academic conferences, such as Gatorade or Coca-Cola, and many of them not really knowing about this or really how deeply seated those conflicts of interest were. So it's just a reminder that it's always important to think about who is behind any organization that you are part of and how they may be influencing the information that you take in. So I hope you enjoyed this episode and that you had some great takeaways yourself. To make sure you never miss an episode and to receive exclusive content from me, head to my website, juliefouché.com, and subscribe to my email list. If you like what you heard, don't forget to subscribe and consider giving the podcast a 5-star rating on iTunes. Also, don't forget to share your stories. If you or someone you know has used lifestyle to overcome a serious health challenge, please send me an email at info@juliefouché.com. I'll choose some of these inspiring stories to share here on future episodes. Don't forget you can train with me through Beyond the Whiteboard by visiting trainwithjuliefouché.com. Thank you again so much for listening, and I'll catch you next time on Pursuing Health.